Have you ever seen your elderly father or grandmother repeatedly scratch various parts of their body? You might have dismissed it as simple dry skin or a harmless habit. But what if I told you that these itchy areas could be indicating something vital about their health? Today, we will look at 5 specific body regions where chronic itching could indicate something more serious. As someone who has spent years working with elderly patients, I know how easy it is to overlook these early warning symptoms. Many families discover a problem only after it has progressed to a severe level. Understanding these signs early can make a significant difference in receiving the appropriate care at the right time. In this video, we will examine 5 specific body areas where itching is more than just skin irritation. We will discuss what these itchy spots might imply, when to worry, and most importantly, when to contact a doctor. This information could help you detect potential health issues at an early stage, leading to better outcomes and greater peace of mind for you and your loved ones. Before diving into these 5 crucial areas, understand that the goal is not to cause alarm or worry. Instead, it is to teach you how to be a better caregiver or advocate for your elderly loved ones. Consider it an additional tool in your caregiving toolkit. The information provided is based on years of medical research and real-world experience. Although some of these symptoms may seem alarming, remember that early detection often leads to more effective treatment options. By the end of this video, you will know exactly what to look for and what to do if you see these warning signs. If you found this material useful, please like and subscribe to our channel. We periodically publish suggestions and information on elder care that can help you better support your loved ones. Also, remember to enable notifications to avoid missing any future videos on the health and well-being of elderly individuals. I especially recommend anyone caring for elderly family members to watch this video to the end. Each of the 5 sites we will discuss can provide crucial information about your loved one's health. What seems like simple itching could actually be your body's way of communicating with you. Now, let's take a look at these 5 crucial regions. Starting with one of the most common places where elderly individuals experience persistent itching, remember that knowledge is power, and recognizing these symptoms can make a significant difference in someone's life. Are you ready to learn about these 5 key signs your body might be sending? Let's begin our journey towards a better understanding of elderly health with these often overlooked indicators. Let's start with the first area where itching can be a warning sign: the lower legs and feet. Many elderly individuals experience itching in this area, and although it may seem typical, it is important to monitor it. When elderly individuals frequently scratch their lower legs and feet, their body might be trying to communicate something essential about their circulation or overall health. One of the most common causes of itching in the legs and feet in the elderly is poor blood circulation. As we age, our blood does not circulate as efficiently, especially in areas far from our heart. When this happens, the skin in certain areas lacks essential nutrients, leading to dryness and itching. You might also notice that their skin appears different, possibly purplish or bluish, or feels colder to the touch than the rest of their body. What makes this so concerning is that poor circulation is more than just a comfort issue. It can also indicate heart problems or blocked blood vessels. If your elderly loved one continuously scratches their legs and feet, especially if they complain of leg discomfort or fatigue while walking, it is time to see a doctor. This is particularly important if they have diabetes or high blood pressure, as these conditions can exacerbate circulatory difficulties. Moving on to our second crucial topic. Itching in the back of the neck might seem like an odd place to focus on, but itching here can reveal much about a person's health. When elderly individuals frequently scratch the back of their neck, it could be due to nerve or spine issues associated with aging. Think about how often we look down at our phones or books, or how much time we spend sitting. All these factors can affect the nerves in the neck. Neck itching can be accompanied by other symptoms such as headaches, difficulty turning the head, or a tingling sensation that spreads down the arms. If you observe these combined symptoms, it could indicate pressure on the neck nerves, possibly due to arthritis or other spinal disorders common in old age. Do not ignore these symptoms. They are generally treatable if detected early. The third area to address is the chest and upper torso. When elderly individuals experience itching in this area, it is important to seek medical assistance, as it could be a sign of heart or lung problems. Before noticing breathing difficulties or chest pain, a person might experience an unusual itch or tingling in the chest. This could be due to variations in blood flow or the body trying to communicate that something is not quite right. If the chest itching comes and goes, especially during physical exertion or stress, consult a doctor. Additionally, if you notice your loved one scratching their chest more at night or while lying down, it could indicate breathing difficulties. Remember, our bodies often try to warn us of problems subtly before more significant symptoms appear. What makes all these indications so important is that they usually appear gradually. It is easy to dismiss mild itching as dry skin or a passing discomfort, but when it occurs repeatedly in specific spots, it is as if your body is trying to alert you to a problem. The idea is to identify patterns. Does the itching worsen at certain times? Does it include other symptoms like swelling, discomfort, or changes in skin color? Anyone caring for an elderly person should be aware of these warning signs without worrying too much. Sometimes, simple treatments like applying moisturizing cream, switching to gentler soaps, or wearing looser clothing can be effective. However, if these basic treatments do not work or if the itching is chronic and irritating, it is better to consult a doctor. They can perform tests to see if there is an underlying health issue that requires treatment. Also, keep in mind that many elderly individuals may not report these symptoms themselves. They might believe it is simply a natural part of aging or feel embarrassed to discuss their frequent itching. Therefore, it is crucial for caregivers and family members to ask about these symptoms and take them seriously when they arise. Please let me know in the comments if any of these indications sound familiar, especially if you are caring for an elderly family member. Sharing experiences can help others understand what to look out for. Now, let's move on to the next section, where we will look at two more crucial areas where itching can be a warning sign. Now, let's examine two more areas where itching in the elderly requires specific attention. The fourth topic we need to address is the hands and wrists. This is a part of the body we use constantly, and when elderly individuals experience itching here, it could indicate a variety of problems that require our attention. When elderly individuals experience itching in the hands and wrists, it could be due to more than just dry skin. Think about how often we use our hands daily for eating, writing, handling objects, or simply resting them in our laps. Many elderly individuals begin to experience itching in the hands or around the wrists, which can indicate something about the health of their joints or circulation. Itching can occur before the onset of pain or stiffness in the joints. One thing to consider is if the itching worsens when they try to use their hands for daily tasks. If you see your loved one scratching their hands after activities like writing, knitting, or using utensils, it could be a sign of arthritis or nerve problems. The itching can also be accompanied by a burning sensation or tingling, indicating nerve tension in the wrist. Irritation of the hands and wrists is especially important because it is through our hands that we interact with the world. If an elderly person avoids activities because their hands hurt or itch, they may lose independence, stop doing things they enjoy, or have difficulty with fundamental daily activities. Therefore, it is essential to treat this condition with care and have it checked. The sixth area to address is the lower back and hips. Many elderly individuals experience itching in this area but may not think to mention it to their doctor. When elderly individuals experience itching in the lower back or around the hips, it could be due to various health conditions that require attention. Itching in the lower back and hips could be due to kidney problems. Our kidneys help clean our blood, and when they do not function correctly, itching can occur throughout the body. If you notice your elderly loved one frequently scratching their lower back, especially if they are tired or notice changes in how often they need to use the bathroom, it could be a clue that their kidneys need to be evaluated. Another reason to pay attention to itching in this area is that it could be due to nerve abnormalities in the spine. As we age, the bones in the spine can put pressure on the nerves, generating unusual sensations like itching. This can happen more frequently when your loved one sits for extended periods or wakes up in the morning. Sometimes, the itching is accompanied by back discomfort or stiffness in the limbs. This area is especially problematic for the elderly, as it is difficult for them to reach their lower back to apply creams or lotions. This means the itching can continue without treatment, leaving them sore and irritated. It is essential to help them maintain proper skin care in this region and listen when they complain of irritation they cannot relieve. If you notice your elderly family member frequently trying to scratch their lower back or hips, especially by rubbing against furniture or using back scratchers, mention it to their doctor. Although it may seem like a minor issue, it could be an early sign of something that requires medical treatment. Remember, when we talk about itchy areas, we are looking for more than just a simple itch. The combination of symptoms or their duration usually determines if we should be concerned. Some itching is normal, especially as the skin dries with age. However, if the itching is chronic, worsens over time, or is accompanied by other symptoms, we should pay more attention. Now that we have covered the 5 areas, let's see what we can do to support our elderly loved ones when they exhibit these symptoms. In the following section, we will discuss the practical steps you can take and when it is appropriate to seek medical attention. Now that we have analyzed 5 key areas where itching can provide us with crucial clues about health and old age, let's discuss what you can do with this information. Remember that information is only useful when put into practice. First, think about your elderly loved ones. Have you seen any scratching in the areas we mentioned today? What seems like a harmless habit could actually be an attempt to communicate something important about their health. Do not ignore these warning indicators. They could be early signs that help prevent more severe problems in the future. When it comes to caring for our elderly loved ones, being attentive is one of the most important things we can do. Look for patterns in their behavior, such as if they scratch more frequently at certain times of the day or after specific activities. Be aware of any other changes you notice, such as changes in skin color, swelling, or if they seem more tired than usual. Here are some important things to remember if you notice persistent itching in any of the following 5 areas: legs and feet, back of the neck, chest and upper torso, hands and wrists, or lower back and hip area. Do not wait too long to seek medical attention. When it comes to the health of the elderly, it is always advisable to be cautious. A simple doctor's visit can help detect problems early when they are easier to treat. I would love to hear about our viewers' experiences in elder care. What is your age, and where are you watching from? Your age and location can help us understand how elder care varies worldwide. Share your story in the comments section below. It can help someone going through a similar situation. If you found this information useful, please give the video a thumbs up. It helps us reach more people who may need this information. And if you have not already, hit the subscribe button and enable notifications. We often publish valuable tips on elder care that can significantly impact someone's life. Remember, being a caregiver is not easy, but you are not alone in this journey. Many of our subscribers are going through similar circumstances, and we are here to support each other. Leave a comment below with your age and location and let us know which of these indications surprised you the most, or if you have noticed any of them in your elderly loved ones. Thank you for watching, and do not forget to take care of yourself while caring for others. See you in our next video, where we will share additional ideas on elder care and health. Until then, stay alert and continue showing your elderly loved ones how much you care for them. Stay healthy, stay informed, and see you in our next video.